I checked on my baby 42 times last night. I keep having dreams, replaying the event over and over again. I can't really seem to talk to my husband about it. I just keep reliving it like it just happened. This might be the chief complaint of someone with PTSD postpartum. Hi, my name is Dr. Scott. I am a board certified psychiatric nurse practitioner. I think that it's important to start with the fact that however a mom experienced her birth to be, perceived her birth to be, if it's traumatic for her, it's traumatic, even if it doesn't necessarily align with what the definition of trauma is. So the DSM has a very clear-cut and pretty narrow definition of what trauma is. About 25 to 35% of women would describe their birth experience as traumatic, which is actually pretty high. However, having a traumatic birth experience does not equate to having PTSD. So let's say of those 25 to 35%, about 2% to 9% will actually go on to qualify as having post-traumatic stress disorder. The symptoms have to be present for a month or more. What is PTSD? PTSD is basically a cluster of symptoms. We should see some issues with hyperarousal. We should see some issues around mood, around intrusive symptoms, and then there should be avoidance symptoms. So if we start with intrusive symptoms, what those are going to look like, that's going to look like nightmares. That can be considered as intrusive is dissociation. So mom can dissociate, like when it comes to mood or like cognitive issues, this mom with PTSD might be irritable. She might have issues maybe blaming the infant for what happened. She might also not feel attached to the baby. When it comes to hyperarousal symptoms, that can look like being really easily startled. So we usually say like an exaggerated startle response. So, if someone maybe comes up behind you or there's a loud noise, the mom with PTSD is going to be way more startled than maybe someone who didn't have PTSD. That can also look like hypervigilance. So checking on a baby 42 times at night, not wanting to talk about anything or watch anything related to pregnancy, those are all those symptoms would fall under avoidance. There is treatment for PTSD, whether it's medication or therapy or a combination of both.